almost 14,000 men. In October of 2015, and I believe the leader of opposition business in this place will address this, more than 2,000 patriotic Bahamians at Bahama were laid off. 2,000 Bahamians, Madam President. Last year, the Right Honourable Prime Minister said he was building a stronger Bahamas. And this year he says he has an agenda for modern Bahamas. But in this stronger, modern Bahamas, Madam President, people need jobs. People are losing their homes. Their children need to eat. School fees have to be paid. And now, Lord help us, BEC is planning on increasing the electricity bills by 15%. I ask you, the Bahamian people are wondering, are they better off now than they were 4 years ago? On energy reform, and I'm reminded, by the way, that despite 2 failed referenda, one on gambling and the second on gender equality, that the Right Honourable Prime Minister said that in this term we would have a referendum on oil drilling. I call on the Prime Minister to live up to his promise, bring the referendum to the people, because that is one referendum that clearly needs to fail. Nothing in this budget speaks to a lack of vision than the glaring absence of a clear, concise energy reform policy. This week we heard of a plan to write off the electricity bills of almost 3,000 BEC customers. Now, as much as that strategy will achieve a lot of brownie points, and I think that is what it is, a political strategy, it is not an example of energy reform. Where is the program for mandatory adoption of green energy? We currently have less than 1% of our energy provided by green or renewable energy, even though we have a plan to achieve 30% renewable energy by 2030. But no plan or no pathway as how to get there. The cost of electricity in the Bahamas is a massive drain on our economy. It's a massive drain on the household budgets of ordinary Bahamians. Electricity in this country costs between 40 and 45 cents per kilowatt hour. For comparison, Madam President, electricity in Canada is 10 cents per kilowatt hour and 12 cents per kilowatt hour in the United States. Now, even though most of the energy generation capacity is centered in Grand Bahama and in Nassau, I'm going to focus on Nassau. We have 2 plants. One is at Blue Hills, the other is at Clifton Pier. And together they generate about 370 megawatts. That's 370,000 kilowatts, or 370 million watts. Everybody's familiar with a 1 watt or 10 watt or 60 watt bulb. There are 8,760 hours in a year. So on any given year, BEC generates about 1.6 billion kilowatt hours. Unfortunately, because of the state of our power plants, neither Clifton nor Blue Hills are available all the time to meet the demand. Around the world, the standard for electrical generation in municipal plants is to have availability between 92% of the time and 98% of the time. In 2012, the Clifton plant was available 64% of the time, and Blue Hills was available 78% of the time. Again, availability is how often is the service available to meet the demand that's being put to it. When you have an availability that's that low, what it means is load shedding, blackouts, spoiled food, hot, irritable children, mosquitoes, people getting upset at each other. Given the efficiency and the fuel used, the efficiency of our power infrastructure by any measure, Madam President, is poor. Now, just to take this one step further, the efficiency of a power plant is measured by a rating that assesses the amount of energy that's produced for a specific amount of fuel. It is called in the industry the heat rate. It is a general wastebasket term, but a simple concept is that the lower the heat rate, the more efficient the generating capacity. In 2012, and even to now, Clifton and Blue Hills use fairly old-fashioned generators, reciprocating generators. They don't use turbine generators, they use old-fashioned reciprocating generators. And they run on two types of fuel. Now I'm gonna get too technical on this, but oil that comes out of the ground is distilled. And you get 6 different grades of oil. Number 1 oil, number 2 oil, number 3 oil, number 4 oil, all the way to number 6. Most developed countries run on distillates, number 1, number 2, number 3. Those plants that run on those distillates tend to be more efficient, and the heat rates tend to be in the 7,000 to 8,000 range. In 2016, any generating plant that has a heat rate above 10,000 is considered obsolete. Madam President, in the Bahamas, the generating capacity at Clifton and Blue Hills have heat rates. The lowest is 8,000. All the rest are above, and they go as high as 18,000. We are running an obsolete infrastructure. We also use number 6 diesel, also called bunker C. Very few places in the world still use bunker C. Well, certainly in the modern world. And yet, we continue to use outdated equipment, outdated fuel, which is a source of contamination. And there are means of replacing our energy infrastructure, which would result in immediate annual savings to the Bahamian people of between 80 and $200 million per year if we drop the heat rate of the equipment and we improve the quality of the fuel. But this government, Madam President, is not willing to make that transition. I want to know, and the people want to know, why not? This budget, this accounting, these choices, when presented to the jury that counts, the Bahamian people, demonstrates that this administration, when weighed in the balance, has been found wanting. In 4 short years, Madam President, after promising much to many and delivering a little bit to a few, this administration has succeeded in one thing. I'll give them that. They have succeeded in extinguishing the hope of an entire nation, a nation that now wishes to hear and to see and to feel, not promises of better to come, not visions of investments in the ground that are yet to spring up, not more agreements to draft frameworks, to produce concepts, to complete mega resorts that are still not open. Madam President, our people want a clear look at concrete plans and a carefully drafted pathway to restore our nation. And they want to know if those plans include them as major stakeholders. They want to know if they are going to benefit from investment in this country. But after reading this budget, Madam President, it is clear to me that the memo that is being delivered by the people of the Bahamas to the government of the Bahamas on more than one occasion has clearly not been received. It is a new day. It is a new era. Now, Madam President, as I prepare to close, I want to spend the lion's share of my contribution on the area that represents who I am. For the last 22 years, I have been honored and privileged to serve in the hospitals and the operating rooms of the Bahamas. I have worked primarily in Princess Margaret Hospital, a place that I warmly call my hospital. But I spend a lot of time at Doctors Hospital and now the Rand Memorial Hospital. Now, over the years, I've worked as a surgical consultant, caring for people with heart disease, cancer, kidney failure. But I have also spent a lot of time in the battle that has refined and defined my beliefs on what is going on in this country. You see, shortly after returning home, I engaged the problem of violence and trauma. The shooting, the stabbing, the beating, the raping, the abuse of our people by our people. You see, I got involved as a trauma surgeon, as head of our National Emergency Medical Services and director of our emergency room. I had spent 4 years in inner city Baltimore and 8 years in downtown Detroit, two areas that are arguably the most violent places in the United States. I was shocked at the level of carnage in Nassau. And for those who think that I might be inferring that crime has just started, take my word, it has not. I returned home in 1994. I intended to practice as a heart surgeon, or as a blood vessel surgeon, or as a chest doctor. But fate would have it that my lot in life was to fix the blood vessels, the hearts, the livers, the bowels, and the limbs that were blown apart in the gun epidemic that has gripped this country for almost 4 decades. I have been pleased to work alongside other Bahamian giants, men and women who have sacrificed much of themselves and their family life to stand in the gap for our people. Madam President, let me say categorically, if it were not for committed, dedicated doctors, nurses, EMTs, and other professionals who toil every day in this vineyard, who render a service for which they can never be repaid, and for which many are not grateful, the anguish, the pain, and the suffering of our people would be magnified tenfold, and our murder count would be much, much higher. They deserve the appreciation and respect of this nation. Many, but not all of them, are surgeons. And so, at the risk of offending a few, let me name some of them. You know, I joke repeatedly that some of the worst, most tense times of my life are spent with Dr. Mark Weish, Dr. Paul Ramphal, Dr. Karen Rowe, perfusionist Anton Roberts, Nurse Dawn Aubrey, and our open heart team. But you know, when the chips are down and the stakes are high, I wouldn't want it any other way. But I've also labored shoulder to shoulder with others who refuse to back down from this battle. People like Dr. Loxley Monroe and Dr. Willie Shea and Robin Roberts and Dr. Glenn Benaby. And we've been aided and abetted by competent internal medicine doctors and specialists like Dr. Ronald Knowles, Dr. Perry Gomez, Dr. Antari Darville, Dr. Ilsa Grant, Dr. Kristen Chin, Kevin Moss, Barry McCartney, Conville Brown, Percy McNeil, Nelson Clark, and others. I could go on and on. But these are people who have such an intense love of country that they impact human lives. They teach students, and they quietly and competently get the job done. And so it is with this knowledge of the legitimacy and the commitment of their life's work that I have had to bite my tongue when political expediency led to some unfortunate cheap shots from the other side, when we were debating and have been debating national health insurance. To paraphrase the columnist Phil Galanis in his treatment of an unwarranted attack on a Bahamian giant, and this is directed at the culprits, and you know who you are. If you were half the man as any of these, you'd be twice the man that you are. Madam President, we have a murder and mayhem rate that defines us as one of the 20 most violent countries in the world. Now that's reality. That is my day-to-day reality. And it is not changed by the excuse of any minister, any commissioner, the prime minister, or any other politician. At 3 o'clock in the morning, when you are elbow deep in a teenager's chest, sewing up a hole that's been created by a copper-clad bullet, fired deliberately into that little boy's chest to harm or to kill, out of which is pouring the essence of his life, whether it's dark red or bright red blood. And when you have inadequate blood products, a pharmacy that's sometime out of medication, an emergency room that's overcrowded, surgical instruments that need to be repaired, but they haven't been repaired. You can't afford the distraction of political posturing. You just shut up and get it done. Because if you fail, the murder count climbs and another family is left to grieve. Very few people have any idea what it's like to walk into a waiting room to confront an anxious family, hopefully to give them news that all will be well. But sometimes you have to tell them that their son or their father or their brother is dead. You do that 10 times, and you get an idea of what's wrong with our system. You do it 1,000 times like I've done it, and you have no tolerance for excuses that we can't do better. I began my involvement in politics with an agenda, and it's the same agenda that I have today. It's a healthcare agenda. I believe that our people deserve better, that we can provide it better, that we can do it now. I support universal health care. I support NHI. I support national health insurance. In 2006, I and a few of the physicians at Princess Margaret Hospital, some of whose names I've called, expressed our opinion on a report called the Blue Ribbon Commission Report. The committee was chaired by Dr. Perry Gomez, a person for whom I have great personal respect and fondness. We don't see things always eye to eye, but that in no way diminishes my respect for him as a physician and as a patriot. Now, at the time, I was not public about my political views. There was a red and white tabloid that used to love to refer to me as the PLP doctor. But I was speaking as a technocrat because I had intimate knowledge of the day-to-day challenges of our healthcare system. And I sought to point out what I thought was right with the plan and what was wrong